In this episode of the Health Momentum Podcast, I want to start with a story that will make you stop and think. Imagine running a clinic where everything seems stable, appointments are full, billing is on time, staff morale is high. Then, over the course of a few months, nearly one-fifth of your patient base relocates due to wildfires or floods. Families move, insurance changes, medical histories are incomplete, and suddenly your workflow is unrecognizable. What would you do? How would your practice respond? This is not science fiction. This is the reality many clinics face today because of climate displacement, and it is reshaping healthcare delivery in ways we cannot afford to ignore. Have you ever thought about how patient mobility affects continuity of care? Displaced patients often arrive with interrupted medications, fragmented medical histories, and new behavioral health needs. Clinics are suddenly left with operational chaos that impacts revenue, staff, and patient outcomes. Yet most of our conversations about climate change stay at the public health level, while the day-to-day impact on small and medium-sized clinics goes unaddressed. How can we bridge that gap? How can we anticipate disruptions before they destabilize a practice? I spoke recently with several thought leaders in public health and climate medicine. Howard Frumkin, a public health researcher, emphasizes the need to shift from reactive responses to anticipatory planning. George Benjamin, who leads the American Public Health Association, reminds us that climate equity is health equity, and clinics serving vulnerable populations feel these disruptions most acutely. Aaron Bernstein from Harvard highlights that healthcare infrastructure resilience is no longer optional, it is essential. The common thread: systems, workflows, and billing processes must be designed for disruption, not stability. Let's talk numbers for a moment. Billion-dollar climate disasters in the United States continue to rise year over year. Patient displacement is increasing Medicaid churn, leading to claim denials, eligibility errors, and revenue volatility. Chronic disease management is interrupted and mental health needs spike in populations who have just lost homes, schools, and support networks. For clinic owners, the takeaway is stark. Patient mobility equals operational risk. Ignoring it could threaten the very sustainability of your practice. So what can physicians and clinic owners do today to prepare? Step 1 is to audit your patient panel. Track retention, insurance changes, and geographic shifts. Step 2 is to strengthen documentation and intake protocols so displaced patients can be seen, treated, and documented accurately, even when records are incomplete. Step 3 is to modernize your revenue infrastructure. Systems that are manual or inflexible will struggle under rapid change. Tools that support AI-assisted billing, predictive denial analytics, and automated eligibility verification can protect revenue and ensure continuity of care. There are ethical and legal dimensions as well. Displaced patients often arrive with gaps in their medical histories, yet we must uphold principles of equity, continuity, and non-maleficence. Telehealth may offer solutions, but licensure requirements and privacy considerations add layers of complexity. Small clinics, in particular, are vulnerable if they lack preparedness strategies. Anticipating these challenges is not just about surviving operationally, it is about delivering care responsibly and ethically. I want to ask you directly, how prepared is your clinic for the next wave of climate displacement? Are you tracking patient migration trends? Are you ready for unexpected spikes in denials or insurance errors? Are your staff and workflows flexible enough to adapt when your patient panel shifts dramatically? Think about that and consider leaving a comment. Share your experiences. Your insights may help another clinic navigate these challenges before they become crises. Before we wrap up, here is the core takeaway. Climate displacement is reshaping healthcare delivery today. It is impacting revenue, operational workflows, patient care, and equity. Physicians and clinic owners must anticipate, plan, and invest in resilient strategies. This is where leadership meets responsibility. This is where foresight becomes action. Start asking the hard questions now and start implementing solutions that protect your practice, your team, and your patients. If this episode resonated with you, I encourage you to share it with colleagues. Raise your hand in the conversation. Leave a comment about how your practice is preparing or struggling with patient mobility. Engage with this movement. Your voice matters. Every small clinic, every independent physician has a role in shaping resilient healthcare systems that can withstand the challenges ahead. Thank you for joining me today on the Health Momentum Podcast. Stay proactive, stay informed, and remember, the climate is changing, and healthcare must change with it.